The thing that's really good about Wesley Eating Disorders Centre is it's got a long track record. It's been here a long time, so it's well established. It's part of a not-for-profit organisation. It offers compassionate care and has some flexibility around care in that regard. I think it's a good size. I think sometimes centres can get too large and lose focus and also lose an ability to, as much as possible, personalise care and have collaborative care, but sometimes they can get too small and then they can sort of break down. There isn't enough critical mass. So it's probably a good size. There's probably some room to grow as well. One thing that did surprise me, and I was actually talking with our latest consultant psychiatrist who's joined our team, Dr. Anita George, who just started here at Wesley, just commented to me just earlier today, the length of stay is something that's a bit surprising in this day and age, that we're able to offer people between 6 and 8 weeks, which is a good length of stay, that many centres for various reasons are moving towards shorter length of stay, so that is something that surprised me a bit, and also the length of stay that occurs in the day program. I think it's good. Again, it's sort of not too long. As I said to her, in Germany it's much longer, but that's because they have no outpatient care or day patient programs because all their investment goes into the inpatients. So they actually have very long length of stay, possibly a bit long, but I think our length of stay is good and sort of in this day and age very good. I think it's respect for the patient and listening to the patient and making sure the patient is on board with you. I think someone with an eating disorder, I think very much people with eating disorders may have experienced things being done to them or people not really listening to them, and also feel that the eating disorder is talking to them as well. We spoke earlier about the anorexia nervosa has almost been a power of its own that's talking to the person. So I think meeting people and validating their experience with the eating disorder, saying you understand why they're so anxious about gaining weight, why they get so anxious about what seem perfectly normal amounts of food to eat. So validating that as part of the eating disorder and part of what's constricting them in their lives, but also understanding where they're coming from and validating that, so not making them feel that they're a bad person for having the eating disorder. I think that helps people realise it's not their fault and it's not about them, but also that they need to find themselves again, and that part of the treatment experience hopefully is finding yourself again and sort of overcoming and ridding yourself of that anorexia nervosa. So it does help, I think, in terms of treatment and in terms of recovery. I look for a commitment to patient care and to compassionate care. Obviously some degree of understanding of eating disorders and appreciation of the particular challenges and needs of people with eating disorders, or the capacity, the willingness to learn more as well. I think I'd like everybody to be wanting to learn more, to be wanting to develop in their professional education. It's been a really delight to see. We had the National Eating Disorders Collaboration meeting last week, and in Brisbane it was really nice to see people from Wesley coming to that meeting as well. So I think I really would want people to be wanting to develop, to learn, to grow in their expertise and skills in eating disorder care. Wesley does talk about compassionate care. I suppose part of that is its mission statement, to offer very ethical care to people and to treat people regardless of who they are or where they're from, with all respect. To me, it's sort of putting the patient first and in the centre of care, so that what matters most is the patient, not the program, the walls, the buildings, other things, and that patients feel that they are supported and validated.